Hi friends, good evening. Once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. We are discussing previous year questions and answers. In the previous video, we discussed Staff Nurse Grade 2 exam question paper. Already 75 questions we discussed. Today, we can see in this video from question number 76. Question: when fertilized ovum implants outside the uterine cavity within the fallopian tube is termed as? Options: Option A, ectopic pregnancy. Option B, miscarriage. Option C, incomplete miscarriage. Option D, gestational trophoblastic disease. Fertilized ovum implants outside the uterine cavity is known as ectopic pregnancy. Option A is the correct answer. When the fertilized ovum is implanted and develops outside the normal uterine cavity is known as an ectopic pregnancy. Move on to the next question. Persistent craving and compulsive combustion of substance such as ice, clay, soap, coal, starch during pregnancy is termed as? Options: Option A, thalassemia. Option B, pica. Option C, morning sickness. Option D, heartburn. Here the question is, during the time of pregnancy, the lady is having persistent craving, tendency to eat or eat substances like ice, clay, soap, coal, starch. These all are not eatable substances. Okay, she is having the tendency to eat such substances is known as pica. Option B is the correct answer. Move on to the next question. Syphilis is a sexually transmitted infection caused by? Options: Option A, Treponema pallidum. Option B, human papillomavirus. Option C, streptococcus. Option D, cytomegalovirus. Syphilis is caused by Treponema pallidum. Option A is the correct answer. Second option, human papillomavirus, which cause genital and anal warts. This is also one of the sexually transmitted disease. And cytomegalovirus, option D, which may also cause infections in mother and babies. Okay, and streptococcus, it is not a virus, it is a bacterial infection. And the next question, pregnant endometrium is termed as? Options: Option A, decidua. Option B, placenta. Option C, chorionic villi. Option D, none of the above. Pregnant endometrium is termed as decidua. Option A is the correct answer. Move on to the next question. A neurological condition associated with preeclampsia manifesting with tonic convulsions in pregnancy is? Options: Option A, HELLP syndrome. Option B, disseminated intravascular coagulation. Option C, eclampsia. Option D, fatty liver disease. Her question: neurological condition associated with preeclampsia with convulsion is eclampsia. Option C is the correct answer. Preeclampsia when complicated with convulsions or coma is known as eclampsia. So here it is a direct question. And the next question, taking up of cervical canal into the lower uterine segment during the first stage of labor is called? Options: Option A, dilatation. Option B, effacement. Option C, polarity. Option D, none of this. And the correct answer is option B, effacement. And the next question, example for inhalation analgesia used in labor is? Options: Option A, oxygen inhalation. Option B, hydrotherapy. Option C, TENS. Option D, pre-mixed gas made up of 50% nitrous oxide and 50% oxygen administered via Enders apparatus. In this option, oxygen inhalation is not an inhalation analgesia, hydrotherapy is one type of water treatment, and TENS is not related to inhalation anesthesia. So answer will come option D, premixed gas up to 50% of nitrous oxide and 50% of oxygen administered via Enders apparatus. And the next question, small white follicular cyst commonly known as milk spot, normally which appears on the cheeks, forehead and nose of a newborn which clear within 4 weeks of birth is? Options: Option A, milia. Option B, Mongolian spot. Option C, pigmented navy. Option D, Porcelain stain. The question is small white follicular cyst. Small white follicular cyst or Small white sebaceous gland or sebaceous cyst-like glands appears on the forehead, nose and chin is known as milia. Option A is the correct answer. And Mongolian spot means second option. It is a bluish black pigmentation on the lumbosacral area and buttocks. That is Mongolian spot. Pigmented navy is one type of pigmented lesions. Next, option D, port wine stain means it is one type of birthmark which is mainly seen on the face. Okay, and it is mainly red to purple in color. And the next question, the process whereby dominant graphene follicles ruptures and discharges the secondary oocyte into the pelvic cavity is termed as options. Option A, luteal phase. Option B, ovulation. Option C, menstrual phase. Option D, proliferative phase. The graphene follicles ruptures and discharges the secondary oocyte into the pelvic cavity is known as ovulation. Option B is the correct answer. And the next question, fertilization almost occurs in the options. Option A, ambulatory part of the uterine tube. Option B, endometrium. Option C, ovary. Option D, cervix. Fertilization occurs in the ambulatory part of the fallopian tube or ambulatory part of the uterine tube. Option A is the correct answer. And the next question, the maternal surface of the placenta which is dark red in color is termed as options. Option A, chorionic plate. Option B, amnion. Option C, basal plate. Option D, chorion. Question, maternal surface of the placenta which is dark red and it is termed as basal plate. Option C is the correct answer. The basal plate of the placenta is usually 3 to 6 millimeter in thickness and it forms the maternal boundary of the intervillous space. And the next question, India launched National Family Welfare Program in the year. Options, option A 1974, option B 1961, option C 1980, option D 1951. National Family Welfare Program was launched in India in the year option D 1951. And the next question, dash is defined as a failure to conceive within 1 or more years of regular unprotected intercourse. Options, option A infertility, option B hypospadiasis, option C varicocele, option D anovulation. And the correct answer is it is infertility. Failure to conceive within 1 or more years of irregular unprotected intercourse is known as infertility. And the next question, dash is the confirmative test for HIV infection. Options, option A PCR, option B Western blot test, option C ELISA, option D RT-PCR. The confirmative test of HIV, human immunodeficiency virus, is Western blot test. Option B is the correct answer. Move on to the next question. Direct contact with the skin of mother which provide biologically controlled heat sources to keep the stable low birth weight babies warm is termed as options. Option A kangaroo mother care, option B lying in ward, option C open care system, option D keeping in incubator with radiant warm. The question is direct contact with the mother, that is direct contact with the skin of the mother and which is usually provide heat and warmth to the babies, especially in low birth weight babies, is termed as kangaroo mother care. Option A is the correct answer. And the next question, thickened mucus that form a cervical plaque during pregnancy is termed as options. Option A placenta previa, option B abruptio placenta, option C pseudocysis, option D operculum. Here placenta previa and abruptio placenta is not the correct answer. Pseudocysis means it's a false pregnancy, although the lady is having the signs and symptoms of pregnancy but not carrying the fetus. So here the correct answer will come operculum. Option D is the correct answer. And the next question, the intermittent irregular painless uterine contractions which occurs during pregnancy which has no effect on cervical dilatation and effacement is options. Option A Braxton Hicks contraction, option B true labor pain, option C late deceleration, option D effleurage. The intermittent painless irregular painless uterine contraction is known as Braxton Hicks contraction. Option A is the correct answer. And the next question, the anterior posterior diameter of the fetal skull, which extend from the midpoint of the chin to the highest point on the sagittal suture, which measures approximately 14 cm, is termed as. Options: option A, mendo-vertical diameter; option B, submendo-vertical diameter; option C, mendo-brachmatic diameter; option D, occipito-frontal diameter. Here the question is anterior posterior diameter of the fetal skull, which extend from the midpoint of the chin to the highest point of the sagittal suture, which is approximately 14 cm, is known as mendo-vertical diameter. Second option, submendo-vertical diameter, which is 11.5 cm, and third option, submendo-brachmatic diameter, which is 9.5 cm, and occipito-frontal diameter, which is 11.5 cm. Here our mendo-vertical diameter 14 cm. And the next question, the peripheral outpost of the existing healthcare delivery system in rural area is. Options: option A, subcenter; option B, primary health center; option C, community health center; and option D, rural hospitals. Healthcare delivery system in rural area is by subcenter. Option A is the correct answer. And the next question, the general norm of selection of one accredited social health activist or ASHA for the population of. Options: option A 600, option B 800, option B 1000, option D 1500. So in general norms, one ASHA covers about 1000 population. Here the answer is option C, 1000. And the next question, the new initiative under National Tuberculosis Elimination Program except. Options: option A, Nikshay; option B, ban on TB serology; option C, direct benefit transfer scheme; option D, link worker scheme. And the correct answer is option D, link worker scheme. All others are included in new initiative under National Tuberculosis Elimination Program. And the next question, Janani Shishu Suraksha Karyakram entities. Options: option A, under 5 children; option B, pregnant woman; option C, lactating woman; option D, elderly. Janani Shishu Suraksha Karyakram is mainly focusing on the pregnant woman, and its aim is to provide health facilities for pregnant women and mainly focusing on their deliveries and improve maternal and child health care. So here the correct answer is option B. And the next question, which of the following is not the function of a store management? Options: option A, preparation of receipt; option B, inventory control; option C, procurement; option D, arranging inspections. Here all preparation of receipt, inventory control, arranging inspection, all are the functions of store management, but procurement is not the function of store management. Procurement means it's to purchase all the goods necessary in items for the store. That is not the function of store management. Move on to the last question, 100th question. The meaning of direction, guidance and controlling the workforce to accomplish the assigned task in the management processes. Options: option A, delegation; option B, supervision; option C, motivation; option D, observation. And the correct answer is, it is supervision. Option B is the correct answer. Here we discussed one question paper, staff nurse grade 2 exam question papers. This is one of the previous year question papers. These questions also will helpful for your exam preparation. If it is useful for your studies, please share to your friend circle.